Speaker, I would ask the minister and this government to stick to the facts like they have always stated. The fact is this government has failed to prioritize hard-hit communities. My community of Scarborough is one of the hardest hit in the province. But when it came to putting equitable strategy, this government has failed. Just this morning, this government voted against the motion to implement an equitable vaccine strategy. Speaker, when it came to COVID testing centres, this government failed, and our community had to fight for more COVID testing centres. When it came to COVID relief, our communities had to fight for more support. When it came to more vaccines now, yet again, we're fighting for more vaccines for our hardest hit communities. With the lack of access to clear communication and more vaccines, our communities are left in the dark. So I would ask again, will this government commit today to more equitable vaccines for our hardest hit communities like Scarborough, Mr. Speaker?
And the Minister of Health.
Thank you, Speaker. Well, the short answer is yes, but Speaker, I would say through you to the member opposite, speaking about the facts, we have created a very equitable plan for the distribution of vaccines across the province, including a bioethics specialist on the vaccine task force. This was created with a lot of thought, with a lot of effort, with a lot of looking at areas across the province that have been hardest hit. And so while our distribution of the vaccines is based primarily on population size, it also builds in factors relating to the situations in each community and communities that have been hardest hit. And in those communities, they will be receiving more vaccines because they need to in order to get the level of transmission down. So we have paid attention to that from the beginning and will continue to do so in the future. And saying specifically to this member, your area will be receiving more vaccines because they have been more badly hit by COVID-19.